Thank you, thank you, thank you. Good morning. What does it mean to be courageous? Daring, fearless, or brave? My father was brave, maybe too brave for his own good. You see, at the age of 45, he was diagnosed with cancer. He never told anybody until a year later, when he had 2 weeks to live. I remember this time because I went to go visit him, and I was responsible for feeding him and taking care of him, and I had absolutely no clue what to do. But I knew I had to be accountable for his care for those 3 days. Growing up with brothers, I had no choice but to be accountable. You see, with siblings, you learn not to only look after yourself, but to take care of others as well. Now, of 5 brothers, would you believe that I was the only one who needed glasses? I never understood it. But I must say, my brothers never made fun of me about it. Unfortunately, I just can't say the same thing about my friends, who are probably the reason why when the opportunity came, I decided to get surgery. Now, I wanted to be like my father and be brave, so I went to this initial consultation by myself. Honestly, because I didn't want anyone else to voice their opinion or try to change my mind, because my brothers, my friends, they never knew what it was like to wear glasses. Typically, I hated going to the eye doctors because, well, if you wear glasses, you know that you never receive any good news. It's either your vision's still bad or it got worse. But this eye doctor appointment was unlike any other appointment I have been to before. I was treated like a VIP club member, appreciated for having lousy vision. I was automatically convinced that if I can get this procedure, then this is exactly where I'm going to do it. Weeks later, I wake up ready and fearless. I was confident that nothing would go wrong. As soon as I walked into the clinic that morning, I instantly noticed a difference. There was no more VIP treatment. I was in a room with a bunch of other patients, all receiving the same procedure as me. We signed mountains of paperwork and followed each other in a line, one by one, like cattle waiting to be processed. After surgery, I went home. My brother, he guides me inside just to make sure I make it in safely. I take off my sunglasses, and to my surprise, I couldn't see a thing. It was actually worse than ever before because I was in so much pain that I didn't even want to open my eyes to try to see. So, I decided to sleep for the recommended 4 hours. I wake up 4 hours later, and still nothing. Hours later, I still can't see, and now my mind is racing a mile a minute. I'm thinking, am I ever going to see again? Because my mind's moving, but my eyes won't open. How am I going to take my medication if I can't even open my eyelids to get the eye drops in them? Should I call my brother and ask him to take me to the ER, or is that just too premature because I don't want to be a baby? So I tell myself to calm down because this is normal, right? I mean, what's actually normal at this point after that procedure? I didn't know. Ultimately, my surgery was a success. But it's just one of those things that sound great until you go through with it. And then you feel the pain, the concern, and the regret. You see, where I went wrong was not involving somebody from the start. I completely neglected the opportunity of having someone there with me to ask the right questions, gather the correct information, and be prepared together. As patients, because we are all patients, it's important that we know exactly what's going to happen, and someone close to us does too. So when considering surgery or any type of medical treatment, yes, it's great to be brave, but we also need to think smart. We need to start thinking 3R so we don't end up in the ER. 3R incorporates trust, guidance, and helps bridge the gap of communication. It does this by establishing a structure around responsibility, requirements, and relationships. What's my role as a patient? What am I being asked to do? And most importantly, who is going to be accountable to help me with my care? Now, picture all of this on a single digital platform. CareScriptions. CareScriptions is a patient-centered software for people like us. Now, when I say people like us, I mean like myself, my father, or any one of you or your loved ones who are considering surgery or have a chronic medical condition. It allows us to leverage digital technology to communicate, collaborate, and engage with our care team members. The education and information section is physician approved for patients and their family members to use as a guide for surgery, to know what will happen day of, and to help prepare for recovery. The information is concise and simple to navigate. My brother could have easily used something like this to actually see if my eyes not opening during that time was indeed normal. As a patient, we can also view our digital care guide, which reminds us of daily care tasks to complete throughout the day. The care guide even has a checklist to allow us to indicate when each task has been completed. So to make sure we're taking things seriously, our level of compliance can be easily indicated using these color indicators. For example, in my situation, I was asked to take medication twice a day for 3 weeks. So if it's red, my family, my doctor can easily see that I haven't done anything. If it's yellow, that means, well, maybe at least he took his morning drops. And if it's green, it means great. I have done everything necessary to ensure optimal recovery. Nowadays, it's also common for a patient to have more than one physician. So with this platform, we can add every doctor necessary for that specific procedure, whether it be your primary care physician, your physical therapist, surgeon. And as a physician, you can view updates such as vitals, symptoms, images, medication, and even initiate a video call if needed. It truly puts the power of care right in our hands. So today, CareScriptions has been implemented in hospitals such as MD Anderson, Cedars-Sinai, and Oklahoma University, who have all experienced fewer patient call-ins, lower readmission rates, and increased patient satisfaction and adherence. The platform outlines responsibilities with checklists and daily reminders. It goes over the requirements in the education and information section. And it impacts relationships by creating a meaningful purpose for all members involved. At MedWell Solutions, we take care of those who take care of us. Not only do we want patients to learn and engage, but we also reward them and their family members for being proactive and accountable. Sometimes when we make these life-changing decisions, it's important to be courageous and brave, just like my father before he passed. But being brave does not mean handling things alone. So now, with this solution, patients will never have to feel alone again, but instead empowered and supported. Thank you.